Alright, so for treating the pathogens, the bacterial infections, the worms, the parasites, I use a doctor by the name of Dr. Jim Smith. He's an osteopathic physician in Ohio, and he's very skilled. A huge part of his practice is devoted to helping people with these types of infections, so he really understands how to prescribe, and he helps doctors all over the country help their patients by prescribing for them. What you will do when you have a patient who has an infection like this, you go to drjimsmith.com, drjimsmith.com, and on his webpage you'll see a link that says patient forms. So you go to patient forms and you're going to print out a bunch of short male and female health history forms. And you're going to make different packets for them. So if you have a male, obviously they fill out the male form. If you have a female, they fill out the female form. They'll do some brief health history. On the third page of the form there's information there, or a space there for credit card information. He does charge for this service. His fee is $150. That goes directly to the patient. The patient pays for that. And then what he will do, they'll fill the information out. You will take the results from the test, so the health history along with the results from the test, and you're going to fax it to Dr. Jim's office, indicating exactly what you want him to treat. So if they have H. pylori infection, say, Dr. Jim, please treat H. pylori. And then what he will do is he will write a prescription for your patient and send that prescription to a compounding pharmacy in Alabama. And that compounding pharmacy does work with insurance, and they also have cash prices. Okay, so it's basically your patient fills out the form by going to, well, you're going to go to the website, print out these packets from drjimsmith.com for the male and female short health history form, have your patient fill it out, fax over the health history form to Dr. Jim's office with the test results indicating what you want him to treat. He will then write the prescription, send that prescription to a compounding pharmacy in Alabama. The compounding pharmacy in Alabama will then contact the patient directly when that prescription is ready, and then they will facilitate any type of insurance payment or any type of cash payment that needs to be handled at that point. Very simple. That's what I recommend doing. He knows what to prescribe, how to prescribe it, the right dosage for the right duration, the whole bit. So that's how we handle prescriptions here. If you have a patient who is dead set on going to their primary physician, by all means let them try. I always recommend using Dr. Smith. At least you could get the prescription and find out exactly what needs to be prescribed, and they can take that prescription to their doctor and see if they will prescribe it. But if you're going to expose your patient to antibiotics, you want to make sure they do the right thing, and oftentimes their primary doctors are not prescribing it properly. You redo the test and they're still infected, and then they have to go back on the antibiotics. So I like using Dr. Smith for that reason. Okay guys, take care.